Dr. Hina Desai ma'am, though now she retired, still a very enthusiastic practitioner. She's dental faculty dean, MH Krishna Kumar Shiji Bhavnagar University, vice dean, MP Dental College and Hospital Vadodara, director postgraduate research, professor and head, Department of Dentofacial Orthopedics. Our next chairperson is Dr. Tulika Tripathi. She'll be joining us in a short while. Senior professor and head of the department, Department of Orthodontics at Maulana Azad Institute of Dental Sciences, New Delhi. I would like to request ma'am to, Dr. Mandava Prasad sir, CV. I request Dr. Mandava Prasad sir to take the stage. Thank you, sir.
Good morning, friends. I would just briefly like to introduce Dr. Mandava Prasad. He has teaching experience of 24 years, is fellow of Academy of General Education and Perry Fouchard Academy. He is fellow of International College of Dentists and fellow of World Federation of Orthodontics. He is international member AAO also. He is currently professor and head Department of Orthodontics and Dentofacial Orthopedics, Narayana Dental College and Hospital, Nellore, Andhra Pradesh. He has served as an executive committee member of IOS 5 times. He is PhD scholar 2090 till 2022, Dr. MGR University, Chennai. He is PhD co-guide at Annamalai University. He is also a PhD examiner at RGUHS, Bangalore, and Nitte University, Bangalore. He has been invited as guest speaker at various national and international conferences. He is a DCI inspector. He has served as president Indian Dental Orthodontic Society during 2008 and to 2009. Dr. Mandava, stage is yours. Thank you.
Thank you very much, respected Chairperson Hina Madam, for the wonderful words. So, I was just wondering if today this is the state. Imagine tomorrow morning's first session after the presidential banquet. But anyway, now all this iOS head office team will be joining. They have to be here because of the AGM. So my dear friends, I will start with this wonderful quote that is true with all of us, all the academicians or teachers or whoever it is. A little about me. For those of you who don't know me, all my good friends are here, seniors and great academicians in my department. So that is where I started my career, and that was the postgraduate Abhishetty with sir, and my PhD probably early next year I'll be finishing and submitting my books, my batchmates. So that is where I come from, Andhra Pradesh, down south close to Chennai. So I would like to thank the entire organizing team, all dear friends, the organizing chairman, secretary, and the scientific chairman, Ajit Bhai. So that is how I call him. So thank you for the opportunity and to be here, and I am here attending. That logo was sent to the mails. So just relax, enjoy. I made it like a movie for you, but this is the most important thing, which is neglected. And you will also agree with me, I have the evidence to show you from the pioneers. So welcome to the presentation. So that is the topic, self-esteem in orthodontics, the unsung hero. That is very true, because all of you in the first 2 days, the pre-conference courses, then coming to the yesterday's sessions, starting from the various mechanics and the artificial intelligence, Nikubai's lecture. And I wonder if self-esteem has any link with the artificial intelligence. Nikubai has to update me. But in the end slides, he told that has got nothing to do with the human souls. So we'll start with a smile. A positive self-esteem. So the background for my presentation, so this man needs no introduction. So I took an article in 1991, probably later part of the 1991, took this article that MDS was only 2 years. So he says, fine, that is the only article I took to sir, and he said, go ahead. And that was the first study in India on self-esteem and aesthetics. So you don't have mails, Google, all this technology. That time only I have to write one letter abroad. These are the letters. You can see the dates. 1993 with the author's communication. 10 days it will go. 10 days it will come, the air mails. So we finished this study, the self-esteem and aesthetics, and we compared and we got this. I'll tell you the reason as we move towards the end of this presentation. I will tell you why it is higher in Caucasians. So that was, I started my career like that. You can see there, the 28th Indian Orthodontic Conference. After the thesis is over, my paper got selected. I was just a senior lecturer, and that was the date. You can see there, 1993. And I presented in the 28th Indian Orthodontic Conference. There were no PPTs, all this. So the technology, you have only this film slides which will be moving. These are the slides, and that is the certificate in the 1993. So that was my first presentation, my thesis on self-esteem and aesthetics. So if you see the specific goals of early orthodontic treatment, the self-esteem and aesthetics are heading. All of you know this Jackson's triad. I need not tell you about the Jackson's triad. All of you know this, but how it has modified over the years, and we have the research and evidence is there, and it has been modified, and we have, this is Dr. L.V. Peters' article, which is published in a quality Q1 journal. Okay, what is beyond this? And of course, you must have heard, the young budding orthodontists must have heard about the OHR QOL, which is the current paradigm shift that I'll tell you. So the psychosocial factors, beyond that is beyond your treatment, beyond your mechanics, beyond your finishing and detailing. So beyond that is the psychosocial factors, which play a very important role. So the self-esteem, that is true. That fellow is telling neglected. That is very, very true. You will also agree with me. We read these three beautiful statements. Okay, see this. So the Fisk states that the malocclusions are just physical abnormalities, but the impact is psychological. The psychosocial effect, the psychosocial impact will be there, and the self-esteem will get disturbed. So see, the Prophet and Ackerman, if you see, even Prophet has told, we have the evidence here, this article, which is a very old article, 1979, it has been mentioned. You see the main problem, which is frequently neglected. Self-esteem, self-image is frequently neglected. And the Cohen stressed this I mentioned in one of my presentations. Is it time to redefine orthodontics? Yes, very true. You can see the evidence. Cohen has told that long back. You have to include the psychological characteristics, your epidemiological and public health standards. And see this. So the Prophet 6th edition. Somehow I love that pic. I could meet this great man at Sri Lanka, where I was one of the invited guest speaker. After that lecture, my lecture was there. So I could click this pic. So you can see there, this is from the 6th edition of your Prophet. Nowadays, the budding orthodontists are only moving into the Google and all the soft copies. So you need to read some of the textbooks. So you will get the data. Does orthodontic treatment really increase QL and self-esteem? Yes. Prophet says yes. You can see there. And it is the children, adolescents, and the young adults. I'll tell you who is an young adult. So the multiple studies you have, this is stated clearly. Of course, the Bible of orthodontics, that's what our teachers used to tell us. So self-esteem is not everything, just that there is nothing without it. So you see, keep this in mind. So the orthodontist must perceive the patient as a unique being. Empathy should be there, and you're not just the end of the finishing and detailing, following your various ABO guidelines or all the other guidelines on the 17 points, all the guidelines. The most important thing is your self-esteem after the conclusion of the treatment, that you should keep it in mind. So the current paradigm shift, this is with the Graeber Venestal. If you see that book, so that is the first South Asia edition. The paradigm shift is this. You can read, see this, the psychologist Jeffrey Miller. Our vast social primate brains evolved to pursue one central social goal. All of us, to look good into the eyes of the others. So that was there, and this is very important, not just the physical, the mental well-being and the social well-being. That is the topic today, which I'll be telling you. And you can see this is in our city by Kevin O'Brien. All those of you who keep reading about the twin block and the functional appliances, you must have heard of Kevin O'Brien, the RCTs, and you can see he made it into the two parts. The second part is important. That is our related to the self-esteem. Second part, he focused on the psychological effects. That is nothing but the increase in self-concept and the reduction of negative social experiences. And the treatment benefits could be related to improved self-esteem. This is a trial, and you have to believe that. Kevin O'Brien, and this is one good article on the self-esteem and the body image of the orthodontic patient. So the complex nature of the psychology of orthodontic treatment. It is difficult to determine the extent of the influence of the orthodontic patient relationships. That I will tell you in the later slides. What is this relationship? And psychologists, you need to play various roles. This have been already I started in the department telling the postgraduates, you need to be a counselor, a psychologist for your patients, because during the pandemic and the post-pandemic, there is a lot of psychological issues on the rise. We have the evidence. I will tell you about that. Is orthodontic treatment associated with changes in self-esteem during adolescence? Yes. So this 6-year longitudinal study, there is no evidence on the long-term effects. There is not much evidence, but you have the short-term evidence. You have so many, and it has shown the increase in the self-esteem. So basically, this is the concept or the self-esteem, how you see yourself. You need to love yourself and the self-image. So the love yourself, here I would like to tell all of you who know the pop star Justin Bieber. So that song, I have heard it 100 times. That is because of my daughter. She, after her +2, she asked me only one thing: take me to the Justin Bieber show at the DY Patil Stadium, Mumbai. Yes, I took her there. It was a great time at the DY Patil Stadium. 4 years, or I don't remember, 5 years exactly. So she's a music lover, and that is her YouTube. She has some 67 videos. So what is this? The self-love, acceptance, self-worth, and self-love. So the evaluation of the self-esteem before, during, and after orthodontic treatment in adolescents and with dental malocclusion. So the global self-esteem acts as a stable construct during orthodontic treatment. The subdomains of the self-esteem, there are so many, we will come to that. So the self-esteem and self-image are integral components of the one's ability to reach full psychological potential. So the father of psychosocial development, Erik Erikson, that is an essay question for you. If the postgraduates are in here, there is a regular essay question we have also written about Erik Erikson. So our focus today's presentation is on this area, the stage 5 and 6. See that is your adolescents, the 12 to 18 or 12 to 19, and the young adults, or this is also the adult treatments are increased. The great percentage has increased. So you can see there, that is the young adults, 18 to 40. So these two groups we are interested in. You can see all these patients, you can see wonderful changes in the facial aesthetics and the function, all the various procedures, all our orthodontic procedures. But what happens after this, after the finishing, and even your impacted teeth, during the mid-treatment, during the impacted teeth, this you should keep it in your mind. The self-esteem drops, especially in the canine impactions or the various other impaction, incisor impactions, lateral incisor. This is the lateral impaction cases. The self-esteem drops. So you need to keep on counseling the patient. You need to appraise of the good effects. So see that. So the self-esteem, you can see the pre and post, how the self-image has improved. And this is the current generation, the selfie generation. Graeber Venestal, in his textbook also, he mentioned this, and David Sarver, Professor Sarver also mentioned about the selfie evolution. And this is a paradigm shift. You can see how this is, I relate this to the self-esteem. My dear friend Anurag, he was good to share with me this. So the patient asking for a selfie at the end of the treatment, okay, that's what you can see here, how satisfied and how the self-esteem has improved. They keep asking nowadays. You can't say no, because that is the selfie generation. So that is one of our patients and my postgraduate, the happy patient. The self-esteem is elevated post debonding. So this I would like to tell you 1 minute. This is my daughter. You can see there. This was 1 year back. She says, no, I won't smile. You can see the soft tissues. Okay? See the strain. She never used to open. And this is just mid-treatment. Now she is telling, use my photograph in the banners in the iOS programs. Okay? So this is still mid-treatment. You can see there. We are still into the, not to the end wires also. It is just 1725. So she finished medicine and she is in the internship. The self-esteem has improved a lot. and the evidence that orthodontics improves long-term psychological well-being. The long-term psychological well-being, we need more clinical trials to come in. So there is some evidence, but the long-term effects, we need to do some more studies, or the clinical trials should be more on this aspect, the psychosocial aspects. So the long-term influence of orthodontic treatment in adults, an Australian cohort study, there was not much of a difference. This also I will tell you at the end, during the end slides, I will tell you why this happens. So the effect of malocclusion on the self-esteem of adolescents. Adolescents, there is great turbulence. So there is great modification during this age. The middle adolescents and the later adolescents, early, middle, and late adolescents. All of you know that. The present studies see this. With the malocclusion, that there are negative effects on self-esteem. Multiple malocclusions with spacing, crowding, and overjet as the greatest effects. So the evaluation of Min Ho Jung, you can see there, the class 1 the patients with mild crowding and protrusion had significantly better self-esteem. And as the malocclusion is severe, there is less. As the malocclusion is severe, the self-esteem is affected. Only the minor malocclusions, it is not that affected. They had good self-esteem even the pre-treatment. So the comparative or comparison of self-esteem between patients undergoing fixed orthodontic treatment, you can see there, the results show statistically significant association between self-esteem and the time elapsed after treatment. So what is this? Self-esteem, the way we see ourselves. They are the pioneers in self-esteem, Stanley Cooper-Smith. This is an excellent book on self-esteem, the pioneers can see. So our focus today is this area, leaving aside the academic and the physical, the global self-esteem, the social self-concept and emotional self-concept, which is on rise. And now, yesterday also, all my friends, the speakers were telling, now it is the patient-centered orthodontics. You need to focus. Wonderful statement from Stanley Cooper-Smith. So the self-esteem, one of the best definitions is by Rosenberg, defines the self-esteem as a concept of positive or negative attitude towards the particular object that is yourself. So that is Rosenberg. The self-esteem, this is very important. The self-esteem is central construct in clinical, developmental, personality, and social psychology. Okay, that is the heart, your self-esteem, mind, body, spirit connection, and there is overall evaluation of oneself in generalized feeling of worthiness. So the self-concept and the self-esteem, all these are synonymous terms. They are all synonymous terms that you should keep it in mind. So what are the psychosocial benefits of orthodontic treatment? So look at that, the father of psychology, Abraham Maslow. There is no psychological health possible unless this essential care of the person is fundamentally accepted, loved, and respected by others and himself. I already told you, you need to love yourself. Keep that. Psycho means mind, the psychology, the father of psychology, humanistic psychology, Abraham Maslow. He has given the hierarchy of needs. You can see the self-esteem where it stands. See the self-esteem needs and the self-actualization needs. This is very important. Self-actualization, achieving one's full potential. So how do you do it? Yes, all this. You need to focus, you need to balance, your work life. Otherwise, you will end up with stress and burnout. So you see this. You can see this. This is a survey in the Wall Street Journal. If you see that, more than 15,000 physicians has been included, and the nearly half of the Generation X physicians said they felt burned out. That is, the self-esteem is disturbed. The burnout, this is entirely a separate topic. Yes, the orthodontic treatments, look at the systematic review, this appears. So the treatment particularly true for the emotional and social well-being dimensions. Okay, the emotional and social well-being dimensions are nothing but all the self-image and the self-esteem, the body image. So the confidential characteristics of dental aesthetics related to quality of life and self-esteem. So the conclusions, you can see the adolescents and the young adults, that is till the age 39, starting from 13 to 39. Okay, the adolescents and young adults given by Eric Erickson, I already told you. So the self-esteem appears to be more influenced by the self-perceived psychosocial impacts and of course the dental aesthetics. So the orthodontic treatment associated with changes in self-esteem during adolescence. Okay, this study, there is no much evidence to show that we have longitudinal study provide no evidence between the orthodontic treatment and the self-esteem during adolescence, but there are so many studies proving that there is an increase in the self-esteem during the pre, mid, and the coming to the end at the post-treatment. We have good increase in the self-esteem. So the again, this is also a good article, the self-esteem OHRQOL in the school children. So the orthodontic treatment and the self-esteem of the primary school children. So the Min Ho Jung, this is a good article from the South Korean. The clinical study proved that malocclusion and fixed orthodontics treatment can affect the self-esteem in girls. So there is an increase, they found an increase in the self-esteem in the girls. And of course, if you compare the gender, the boys, the males also, there is slightly more in the boys. That depends on the geographical area throughout the globe. So this is one of our systematic review published Q2 journal, and we have moderate evidence to show that the fixed orthodontic treatment improves your self-esteem and simultaneously the oral health related quality of life. So this is also another study in Ho Jung. So the adult orthodontics, this is a rapidly growing area, and orthodontic treatment causes significant increase in the self-esteem and QI. This is very important, providing psychological benefits to the adult patients. Adult patients also, there is an effect on the self-esteem because of the various factors which they go through. And you can see this study, the social appearance, anxiety. The conclusion, there is the improvement in facial appearance after surgery, patient self-esteem increases, and their sensitivity to criticism and social appearance, anxiety. So the social factors, the social appearance anxiety decreases. So same, you can see this study also, there is impact on the self-perceived psychosocial impacts. So this is a cohort study. One of these psychosocial attributes are nothing but your self-esteem. So Evelyn debates, this study has shown the higher the self-esteem and the better the OHR QOL. So the longitudinal study, Karen Kobik, orthodontic treatment, he says that produced no lasting effects on the self-esteem, this study. And of course, Ziller et al., you can see, this is one reason why in the Caucasians, because of the family network, all that, there is good increase in the self-esteem after the post-treatments, whatever, not only orthodontics, even any dental treatments also, there is good increase in the self-esteem. So the Richards, this is a study, this is thesis abstract published later in the AJODO. He has found the overall results. You can see orthodontic treatment enhances the self-esteem, the self-concept who complete the treatment and helps them to be more accepting of themselves. But the sample size was bit less, so we have done with the greater sample and found a good increase in the self-esteem, which I showed you earlier. So the impact of self-esteem on oral health related quality of life of children with malocclusion, there is the impact of malocclusion. There is substantial increase in the children with low self-esteem. And you need longitudinal data will be of value to confirm these findings. This is also a very landmark article. You can see the Stryker and Weiss hypothesis self-esteem is lowered in the presence of malocclusion. So the measurement, let us not go into the measurement part, but I'll just tell you these are the worldwide, what the global scales which are used. The Pearson-Harris this is for the young kids. So the early adolescents, we use the Pearson-Harris. This is the Rosenberg self-esteem. You can see there how many nations it has been used and how many languages this has been conserved. This is the global self-esteem, and it has been modified. You can see there 65, 86, and 2002. It has been upgraded and validated. So this is a very reliable scale, the Rosenberg self-esteem scale. And then you have the Cooper-Smith inventory in the school children. This can be used in the school children. So, my dear friends, so the take-home message for you, keep that in mind. The psychosocial benefits, the self-esteem, the HRQOL, do you charge? We don't charge anything, but you should make the patients aware of the various benefits post-orthodontic treatment, not just the mechanics, the finishing part, and aesthetics. We will also easily be able to identify when you keep this in mind. And as I told you earlier, beyond this, we fulfill other roles. You can see here, this should be in your mind. So the current research you can see there, you need to be a counselor. You need to be a psychologist for some of the patients. That too, during this pandemic, the post-pandemic, the psychological problems are very severe, and it has good effect. And you can see the patients, some patients will be very irritable. That is due to the self-esteem is disturbed and they are moving towards the burnout. This is a phenomenon which is recognized by the WHO. Keep this in mind. When the work-life balance is disturbed, you will end up in burnout. You need to balance your academics, your family, your finances, your research. All these have to be balanced. Otherwise, it will have an effect on the person's self-esteem, and they move away from everybody. So this is the reason, this is what I was telling you. So the self-esteem in the Caucasians, there is good improvement in the self-esteem. The various research, all the evidence support this. And in the European countries, it is mild to moderate increase. And the American, we see that it is just the mild increase is there. That is due to the social and the geographical conditions and the family network there and the conditions there that has an effect on the orthodontic patients. So you can see this, the COVID-19 pandemic outbreak, there are behavioral changes. Okay, the behavioral changes are nothing but the self-esteem, the self-concept, the oral health, quality of life, everything is disturbed, all are interlinked. So keep that in mind. So the psychological burden has increased. All of you know what all we faced during not the first phase, the second lockdown, the deaths, many of the families are affected. So the psychological burden, this has a very solid impact on the patients also. So keep that in mind. So you need to show more empathy towards the patients, and some, as I told you, the burned out patients, you need to do not lose the temper. You need to be more empathetic with such patients. So there is, you can see here, the positive and negative effects. Gautam et al. So the positive and negative effects are there. There are positive effects and there are negative effects during the lockdown. So the experience, the documented evidence, you can see the experience, functional, social, and psychological impairments. So the psychological impairments are more, which has to be noted by the orthodontists, the clinicians. As a clinician, you should keep these things in the mind. So thank you very much. This is our team. I'd like to thank my ortho family at the Narayana Dental College. My contacts, if you want any evidence-based articles on the self-esteem, I can send you. Thank you very much for your patient hearing. At least I had some of you in the hall. Thank you so much.
Thank you, Dr. Mandava Prasad. It was a wonderful lecture. And of course, our self-esteem is always high. To you, ma'am. I request you, our chairperson today, to felicitate our today's first speaker with plaque and certificate.
Thank you so much, Dr. Madhava Prasad. We at our center have also conducted a study in which we had translated in Hindi the PIDAQ, and that has been published in Oral Biology and Craniofacial Research. Thank you so much for your presentation.